Hi, my name is Lori Perlmutter with Pro Resources. Thank you for taking time to join me today in our training on first aid. This is one of my favorite topics because it can have a real far-reaching effect. You never know when you might be called upon to render first aid and actually save a person's life. Actually, a good friend of mine was in a local restaurant in the Fargo area, and it was quite crowded when somebody was calling for assistance and no one responded, and so she did. By the time she arrived there, the person was turning blue from choking, and she was able to dislodge the item that was choking her and perform CPR until the ambulance arrived and saved a person's life. So again, you just never know when or where this might be called upon. So I hope to provide some tidbits of information for you today. Actually, in an emergency, minutes could make a difference. And so we want to address how to appropriately respond and timely respond, to identify the proper procedures for a variety of different emergencies, how to administer first aid when someone is injured, and the key to do no further harm. Of course, if it is care beyond your skill level, we have to be able to recognize that as well. 4 basic rules. The first thing you need to do, of course, is to call for help immediately. We want to get the professionals to get on the scene as soon as possible. We don't want you to delay. What if it's not as serious as it might look, etc. Always better to err on the side of caution, and so I would highly recommend either you yourself calling or identifying somebody nearby to go and make that phone call. Second thing we want to do is to assess the scene. Make sure that it is safe for you. Obviously, if you're coming upon a car accident scene, we don't want you rushing out in the middle of an intersection and now you become the next victim. So we need to assess the scene for safety and take appropriate precautions from there. Then the third rule is to check the ABCs, the airway, the breathing, and the circulation, and we'll talk about that in more detail later. And the fourth is, as I mentioned previously, do no further harm. Those are the 4 basic rules. And again, I mentioned to assess the scene. First and foremost, we want you to call 911, and then you're going to assess the scene. Is it safe? What is happening around this injured person? Is there an electrical cord down that they may have been electrocuted from, and therefore you could be the next victim again? So you need to take particular attention to what's going on around the injured person. Check them for medical alert tags. Do they have a bracelet? Are they a diabetic? Do they have some other medical condition that would help determine what may have happened to this person if they're unconscious? And then do a head-to-toe check. You don't necessarily want to move them very much if they're laying on the ground and unconscious, but you can run their hands underneath if they're laying on their back on each side, just briefly kind of patting them down, if you will. That way you can determine if there's any bleeding or anything going on without rolling them over. We want to make sure we don't cause, again, any further harm, and we don't know if there's a back injury. And move only if necessary. If they are in the path of other traffic because it's a vehicle accident, or if there's water nearby and there's potential for drowning, etc. Fire, of course, those circumstances we have to move the person, but only if necessary. Otherwise, try to render aid right where they are. So we're going to discuss a couple different topics here as far as rendering first aid for specific circumstances. Probably the most common thing you would need to do would be to help somebody if they're bleeding. First and foremost, you have the right to protect yourself, and we want you to wear gloves. Now, you're not going to have those in your back pockets. You're going to need to go get them. That person may kind of be freaking out if there's an excessive amount of blood, and then they see you leaving the scene. Let them know that you're going to go get the gloves, and you'll come back and assist them. If you're not comfortable doing that, and not everybody is, that's totally respected, then let them know, I will go get help and someone will be back. But please communicate that with that person. I would also encourage them, if they are not already sitting down, to make sure that they are seated before you leave them, just to make sure that they don't pass out, faint, or anything of that nature and cause a subsequent injury. So wear the gloves. If you are coming back to render aid, you want to stop the flow of blood, most predominantly done by direct pressure. Put a gauze bandage or something over the area of bleeding and just applying pressure. Obviously, if there's a fracture that's sticking out from there, you're not going to be able to do that. You have to take an alternative practice, and we'll talk about that when we talk about fractures. But if at all possible and you can put pressure directly on the wound, that's what we want to have happen. If that bandage becomes saturated and you then need to apply additional bandages or pressure, do not remove the first bandages. Just add bandages onto there and continue to apply pressure. Use a tourniquet only if all else fails to stop the bleeding. Another method you can use is to use pressure points. They're kind of difficult to determine because of different body sizes, etc. But for the upper limbs, the pressure points are in the armpits, and you can just kind of put pressure in their armpit and move around until you see that there is a decrease in the blood flow and you're getting close, and then you can find the spot. Any lower limb injuries, the pressure points are in the groin. Again, a tourniquet is only if all else fails to stop the bleeding, and once you do apply a tourniquet, do not remove it. Let the medical professionals do that. Hopefully they would be on the scene before you would ever need to determine that you have to apply a tourniquet. If there's been a body part that's been amputated, if at all possible, try to put that on ice. If you have a little baggie or something to keep it clean. We don't want it directly on the ice because it is, for all intents and purposes, meat, and we can freezer burn that, so we don't want to add injury to what's already happened, but we do need to keep it cool, and make sure you send that along with the person for medical treatment, because they can do wonderful things nowadays with reattaching body parts. If someone is choking, if they're still conscious, as long as they're coughing and able to talk, or you can hear breathing sounds, let them try to dislodge the piece by themselves. But if they're not able to talk, then you do want to stand behind them, grasp your hands together, and use the point of your thumb right above the navel and make a fist, and you want to go in and upward. And it has to be quite forceful. What you are trying to do is get that whatever is in there dislodged. You're using the air that's already in their airway to force that out. So you want to make quick upward thrusts so that there's some power behind that. And if you do it too weakly and you're expelling that air, then you're going to run out of air to do it effectively later. So you need to make sure that you're being effective with your first couple upward thrusts, if at all possible. If the person then becomes unconscious and they start to get weaker, let them kind of slide down your body if possible to lay them on their back. We certainly don't want them to go forward and do a face plant. Lie them on their back, straddle them if you can, and then perform abdominal thrusts to continue to try to dislodge whatever is in their throat. Watch for signs of vomiting. You want to keep their head to the side once you have even cleared that, because they may still have an upset stomach, and we don't want anything then again getting back in that airway. If someone's exposed to an electrical shock, of course, call 911 first and foremost. And we want to make sure you do not touch that person until you make sure that all the electrical sources have been turned off. So turn the power off from whatever's around that person, and then try to remove them from that live wire. If at all possible, you need to use, of course, something that is non-conductive. Broom handle, wooden broom handle, of course, rubber gloves, those types of things. Any glass type of materials are non-conductive. So you want to remove them from that live wire. Check them for breathing. Continue to monitor them. An electrical shock, it may appear that there's been no damage initially, and you go off back to work and wait for them to, medical personnel to come back, and boom, something has changed because the electrical shock has caused damage ongoing. So make sure you continue to monitor that person until that professional help arrives, even if they insist that they're fine. We're going to take a look at some eye injuries and what to do with that. Most common foreign bodies, different types of splashes that get in the eye. Any chemical splashes to the eye, you need to wash the eye up to 15 minutes. That is a really, really long time. Go to an eye wash station, use squirt bottles, refill those squirt bottles if you need to for getting anything out of the eye. If a person's wearing contact lenses, they recommend washing it for 5 minutes, take out the contact lens, and go back and wash for another 10. Now you have to kind of balance this out with how severe the injury is and the chemical reaction is that's occurred, as opposed to getting that person to further medical care. Of course, you can call the ambulance, and you can be doing that while the ambulance is on the way. Otherwise, if you can take some portable means to continue to wash the eye while somebody is driving them to a medical facility, that would be great. If there's any cuts or blows to the eye, protruding objects, one means to bandages like it is here. Say it's a pencil in their eye, you can take a cup and at least help provide some stability to that. If it was a longer object, you could take the bottom of the styrofoam cup out there and let it protrude through there if need be. And notice they've also bandaged the other eye because your eyes move in tandem, and of course you want to minimize movement of that eye at all costs, and so you need to bandage both eyes. please be sure that if somebody has an eye injury, they are not driving themselves to the clinic. That may sound like very common sense, but I've actually spoken with somebody on the phone as they were driving to the eye clinic themselves for an eye injury. Plus, they were talking on the phone, so that was a little discomforting. Burns. Most of us have probably experienced first-degree burns, or at least seen it to one extent. We'll talk about those. Second-degree burns, and the most severe, the third-degree burns, is charring, deep tissue damage. So we'll talk about how to treat those types of burns. For first-degree burns, most commonly it's a sunburn. You want to try to cool that area 10 to 15 minutes with cool water. Now, it's not you don't want ice cold, because that's going to be such a contradiction. It can be almost a means of going into shock or sending off chills, etc. So you want it cool, but it takes a long time to get that burning to stop. Otherwise, it will continue to burn. If possible, you want to cover loosely with a sterile gauze bandage. Now, this is a person's back. It's going to be very difficult to do that. So a nice, clean cotton t-shirt, something like that, of course, is appropriate. But something loose to cover the burned area, if at all possible. You can take over-the-counter pain relievers for that, just to be a little bit more comfortable. Second-degree burns usually involve blistering. That's the difference. We want to make sure you don't break the blisters. I do have a little bit more of a graphic photo coming up here. Pretty significant second-degree burns here. Big blisters. We don't want to break them. The blisters are your body's natural reaction to try to heal that area. It protects the burned area while the new skin is growing underneath there, and it helps prevent any infections. If you pop the blisters, there's an avenue for infection to come into the body, and we don't want that, of course. So keep clean and dry to avoid any infection. If a burn involves a very large area of the body, then you want to treat it as a major burn, or like a third-degree burn, which we'll discuss on the next slide. I thought this was interesting. Burns are actually susceptible to tetanus. So if you've had a significant burn, you should make sure that your tetanus is up to date. They are good for 10 years. However, most doctors recommend a booster after 5 years. Third-degree burns, the most severe. Call emergency medical personnel immediately. That can be life-threatening, of course. Do not remove clothing that sticks. That would just cause further damage. Don't immerse them in cool or cold water. That's a little bit different than what you're looking at with the other types of burns. Most often, the reason for that is that could again be another avenue of infection, because so much of the skin has been broken open and the water might not be sterile, and so you have introduced an infection, and now this person's going to have an additional battle on their hands. Maintain or check for their ABCs, the airway, breathing, and circulation, and that's about the best you can do until emergency medical personnel arrive. Elevate the burned parts above the heart if possible. Depending on what's going on, the likelihood of that is probably minimal, but if it is possible, and we'll talk about the reason for doing that with other types of injuries down the road. So if you can, cover them with cool, moist, sterile bandages, cloths, or towels. You know, that's the key. You're not going to necessarily have those sterile bandages. Certainly if it's a situation where they could be getting more debris or infection exposed to them, you want to cover them with something. Do that. But again, best to allow the emergency medical personnel to take care of that when it is a third-degree burn. Exposure to hazardous materials. Okay, say you came across this individual who's lying on the floor. Is your first thought necessarily going to be to go suit up like this gentleman did to come render aid? It all depends on what your circumstances are, right? First thing, call for medical help. Second thing, assess the scene. You notice there is a tank in the background. So I would presume, because this other person has suited up, he knows the chemicals that are in that tank and what the exposure is. So that would be a very vital piece of information as you are assessing the scene and to determine what could be wrong here. Call 911, assess the scene, and then you have to prepare to respond as needed. It may be fully suiting up before you can go in and render aid. That's to protect yourself. You need to do that or you would become the next victim. You need to protect against exposure getting into your eyes, under your skin, inhaling it, or ingesting it. In this case, he's got the full gear. It's a pretty lethal or highly exposed agent that's there. Very difficult probably to watch a coworker there while you are suiting up so you can go in and render aid, because that's going to take some vital time. But again, call 911, get them on the way, and then do what you need to do so that you can render aid, because you're still not going to provide any help if you rush in and you're the next one passed out on the floor. So protect yourself first. Broken bones, look first, as you're doing that assessment. I mentioned just kind of patting the person down. They may tell you that they heard a snap or that something hurt if they're conscious. You may obviously see a fracture if the leg or limb is laying at an odd angle, those types of things. So you want to look, ask questions if they're conscious, of course, and then consider if you can splint it or not. If the limb is lying at an odd angle, we do not want to move it to line it up with anything else. Again, not moving the victim is key if at all possible. If, however, is laying in a position that you can splint it to the other leg or splint it as it lies, and you have materials handy, here is just simply a towel between the legs because you're using the one leg to keep the other one straight. You can do that, whatever means is available. Broken bones, as long as they're not an open fracture where they're also bleeding, you can allow the medical personnel to come and you can wait for that person, just kind of render some comfort measures for them and leave the broken limb as is, rather than, again, the goal being not to cause further harm. We want to make sure that we're not causing more damage by moving it, etc. So if you're not comfortable with that, by all means just leave the fractured limb as it is and then just render other comfort measures to the person that you can. Heart attack. It's not a work-related incident generally, but certainly it happens at work. Most people are pretty familiar with different types of symptoms. There's chest discomfort, upper body discomfort, shooting pain down the arms, back, neck, jaw, even a stomach upset, shortness of breath, cold sweats, nausea, and lightheadedness. So those are pretty common symptoms that a person would have when they are experiencing a heart attack. Treatment, of course, call 911. Make them as comfortable as possible. Try to get them to sit down, calm down, loosen tight clothing. You want to be as unrestrictive as possible, taking a tie off, loosening the top button on a shirt, loosening the belt, loosening shoelaces, taking socks off, etc. It's really, really key that if they are conscious that you can talk to them and get as much information from them as possible. Ask them for medication or check for medication. Are you on high blood pressure medication? Are you taking anything? Do you have nitroglycerin pills with you, etc.? Get as much medical history as you can and just try to retain that information, because there is a potential that they might not be conscious by the time medical personnel arrive. So you could be a key person to relay that information to the medical personnel. Keep them still as possible. Of course, we want to slow everything down and have them resting. Don't give them stimulants, i.e. mostly coffee, of course. Some water, small sips possibly, but even that I would really hesitate on doing. We want to keep the systems as free of everything as possible so that if the medical personnel need to do further tests, etc., they don't have to deal with food in the stomach, etc. So just calming that person down, getting them comfortable, keeping them still are some real key things that you can do for symptoms of a heart attack. Symptoms of shock. If you read this list, very similar to what we just looked at with a heart attack. So sometimes it's difficult to tell what's going on. That's why one of the key things we want to do is to get the medical personnel there and to talk to the person as much as possible. Again, when we talk about assessing the scene is one of the first things. Call 911 and then assess the scene. Shock is a physical response, usually to some emotional trauma going on. You hear about people being in a car accident and the person was walking around in the ditch just fine, and then the next moment they were being life-flighted out and almost died because of shock. So it's really key to assess that scene and see what's going on. Is there a potential that this person's going to have a physical reaction to what is going on around them? If at all possible, get them to lie down, calm down. You want to keep them comfortable. Even in warm weather, oftentimes somebody who is experiencing shock is chilly. So covering them up is a comfort measure. We don't want them to start shivering, having those chills. It just sets the physical body in higher gear, and we don't want to do that, of course. So cover them up if you can. Raising their feet, I mentioned this earlier that we would talk about this. What that does, and this isn't even very high, but 6 to 8 inches if you can, assuming you know there is no back injury. If you know there's no back injury, by all means, if you can raise their feet, what that does is it just increases the blood flow to the vital organs because less is getting to the toes. Their toes might get a little colder, but they're going to have their vital organs well circulated, and that's just going to help their systems all together. Hopefully, it's kind of hard to tell on this picture, but they've loosened her shoelaces. You could even take her shoes off, especially just a comfort measure again. One of the keys that I include in here for treatment for shock that is so key is talking to the person. I said going into shock is a physical reaction to an emotional trauma. So if we can help deflate that emotional trauma or divert them from that emotional trauma, we can help offset the physical reaction that's going on with shock. So talking to them, help is on the way, I'm going to stay here till they come, don't worry, everything's going to be just fine. Do you mind if I tell you a fishing story? Get their mind off of what was just going on and just keep talking to them over and over and over again until help does arrive. That can really help keep them alive. When I mention hypothermia here, there's all types of degrees of hypothermia, from frostbite to the severe hypothermia. Most people in our area are well familiar with it. One key that I like to point out, if somebody has experienced frostbite and they've got the white fingertips as a result of frostbite, we don't want to massage that. Of course, we hear about, if your fingers are cold, rub them together and you have that friction to warm them up. That's one thing, but truly massaging it, if you go deep in there, if there is true frostbite in there, and what's happening is your tissues are actually freezing and it forms crystals in there, and those crystals are very small but they have very sharp edges, and so if you do massage deeply, you are just kind of fraying the rest of the tissues and causing more damage in there, so we don't want to do that for frostbite. Hypothermia, of course, key, warm and dry. Most often it seems to occur when somebody's gotten extremely wet and out in cold environments, so we need to get wet clothes off, we need to get them dry, and then warm them up. Use a warm blanket if you have access to, like a clothes dryer. Take one warm blanket, wrap them up, take another blanket, throw it in the dryer for 5 minutes, and then wrap them up with a warmed blanket. That will help warm them up much faster. If they are able, you can give small amounts of warm liquids, preferably just a warm water. We want to stay away from caffeinated things like coffee, so warm water, some decaf teas, something like that might be appropriate. And then, of course, get medical attention as needed for how severe the situation is. Heat exhaustion or heat illnesses, on the extreme of the frostbite, of course, is the heat exhaustion. Common sense, you need to move them to a cool place, have them lie down, again, elevating their feet to make sure that the vital organs have good, appropriate circulation. Loosen clothing. How many of you know when it's really, really hot out, one of the first things you want to do is kick your tennis shoes and socks off, right? So get their clothing loosened, just take boots off, shoes off, socks off, loosen the belt around the abdomen and any ties, etc., and just cool them off that way. It's a huge benefit. Give fluids if they're conscious and not nauseated. Very small amounts. We don't want them to guzzle anything. This is also kind of common sense. This person's probably been sweating a lot, so they've had a lot of fluids go out. We need to get some fluids in, but not in large quantities at a real short amount of time. So have them sip over a short period of time as long as they're not nauseated. Apply cool compresses if you can. If you're limited in that, key areas are around the back of the neck and in the armpits and even in the groins. Help cool down the core body, which is what we need to do. So you can do that with cool towels, wet towels, etc. Heat stroke is life-threatening, and people can go from heat exhaustion to heat stroke in a rather short amount of time. The key symptom that's different with that is that there is no sweat. The skin becomes hot and dry. Sweating is your body's natural way to try to cool itself off because you're cooler when you're wet. So that's what your body is doing. When it gets to a point that it knows it's not effective anymore, it's like, okay, I'll give up. I'm not going to sweat anymore. Your skin becomes hot and dry, and you're actually like a fever, and your temperature goes up, and that is a medical emergency. You need to call 911 and not delay. So even if somebody's in heat exhaustion and if they're not cooling off very quickly, you might want to be proactive and get medical services there, because you do not have a lot of time to deal with if it goes to heat stroke. You need to cool the person down as much and as fast as you can. In this situation, the cool compresses, dousing them with water, covering them with a wet blanket, and making sure you keep that cool, because their hot body is going to dry that wet blanket or wet towel very fast. So you want to keep new applications of that, whatever it takes to cool this person down. Again, this is a life-threatening condition, and you have to act fast. Monitor them until EMS arrives. Absolutely do not leave their side, and do what you can to keep them cool. So in that scenario, would you move that injured person? I think it's kind of ironic that this person running along seems to have a stethoscope and a blood pressure cuff with her, but that's great. Assessing the scene. That's what we're supposed to do, right? We've called 911, now we're going to assess the scene. Well, if you are this person that was rendering the aid, it appears that she's also a runner. So what is the scene? Is this a marathon and the highway's blocked off? We don't have to worry about traffic? Well, even if we don't have to worry about traffic, he's a lot hotter lying on a black pavement than over on the red surface to the side. Maybe not as comfortable, but it's going to cool it off a little bit. There doesn't seem to be any great areas of shade out there, so that's kind of limited that way. Also, because it appears that he was a runner and went down, you probably don't have to worry about a back injury or anything of that nature, so it would be safer to move him. But it's all about assessing the scene, knowing what's going on around him. And obviously this person kind of had some inside information because she's wearing running clothes as well, so she would be able to make determinations based on that. Epileptic seizures, seems like they're less and less nowadays because of medication and all those things, but it does happen. Call 911. You, again, want to get medical emergency services there as soon as possible. Remove them from hazards, and what that means, if they go into a seizure at the top of the stairwell, you want to make sure that they're not going to fall down the staircase. If they're on a manufacturing floor, you want to make sure that they're not close to any moving machinery, those types of things. But basically, you can't stop the seizure from happening. You can't, hold them down per se and stop thrashing around. You just want to make sure that you minimize the things that could injure them around them. Watch for breathing. Keep them as comfortable as possible. It's kind of been a wives' tale, etc. That they could swallow their tongue. It really can't happen, so don't worry about anything being in their mouth. Let the seizure take its course. Watch for breathing. Take appropriate action if you see that they've stopped, of course, but other than that, just keep them comfortable. It's going to be very rare that it's going to stop their breathing, but we do want to monitor that. So those were just some of the general types of things that you might encounter out there. We want to make sure you understand first aid procedures for eye injuries, what to do if somebody's bleeding, if they're exposed to various hazardous materials, what do I need to do to protect myself first. If there's broken bones, how do I splint them, heat exhaustion, and life-threatening heat stroke. Please pay attention to that. And on the other side of that, we had frostbite and hypothermia, what to do for burns, and then epileptic seizures. So there will be a short 10-question worksheet to assess your understanding of these things, and I appreciate your time today. Thank you very much. Keep in mind that medical emergencies can happen at any time and anywhere. If you can act quickly, calmly, and correctly, you have the opportunity to be a hero. So consider being certified in first aid and CPR. You can check with your on-site employer if you are interested in that and see if there's opportunities in your area.